if you see a child with a groin swelling, with intermittent crying, and then when they cry, the swelling gets more pronounced, it is a hernia. Once it's a hernia, it's unlikely to disappear. You can massage and make it disappear at that point of time, but then it'll reappear again. So massaging does help by reducing it, but it doesn't make it go away completely. So once there's a hernia, a surgical procedure is required to prevent further complications of the hernia. Okay. So 95% of all hernias appear in boys and 5% in girls. This is because of the way the testes descend. The testes descend through this hole through the muscle into the scrotum. 1% of all boys will have a hernia. It's one of the commonest operations I do for newborn as well as for older children. I do the operation by Keyhole method, whereby I place a camera into the belly button and 2 other small cuts on either side of the flanks. The cuts are about 3 millimeters wide. Once the camera is in the tummy, we can examine both sides. So if the child presents with a hernia on the right side, which is the commoner side, they can potentially have a hernia developing on the other side in about 15% of times. So we can check the other side as well whilst repairing the hernia on the presented side. So that avoids the child having a second surgery when a hernia appears on the other side. In girls, we can also examine the structures, making sure all the uterine structures, the ovaries are all in the right position and they're both healthy. That allows us to examine as well as check the other side. So the operation is done, they go home same day, unless the baby is less than 3 months of age. They stay in overnight and then they go home next day. I use glue on the wound. The glue will be a waterproof layer so they can shower once they go home. And the wound becomes watertight after about 3 or 4 days, at which time the glue would fall off. So often I see the child running around after the operation and they're almost back to normal within the next 2 or 3 days with negligible pain.